This presentation will be about focal fatty sparing and focal hepatic steatosis. I will show some examples of ultrasound, CT, and MRI. Focal fatty sparing is a condition observed in the liver where certain areas are unaffected by the diffuse fatty infiltration. It may mimic a mass. Typical locations include the quadrate lobe, gallbladder fossa, around the falciform ligament, around the vessels, and the subcapsular areas. Typical features include no mass effect, not distortion of the vessels, and if we can detect the central spot of a vein branch, it's quite diagnostic. In ultrasound, we should consider that the background is fatty and the spared area is not. That's why the background liver is hyperechogenic due to fat, and sparing areas appear hypoechogenic and the background parenchyma. Central vein may be demonstrated by Doppler imaging. Here are some examples. The hypoechoic area in the gallbladder fossa, and another one in the subcapsular area, another one here in the gallbladder fossa, around the vessels, and in the subcapsular area here. This mimics a tumor. This is a good example in the quadrate lobe, hypoechogenic area here, with a central vessel which is proven to be a portal vein branch by spectral Doppler imaging. In CT, generalized steatosis reduces liver attenuation. This means the liver is hypodense than normal. Focal fatty sparing area will lack this reduced attenuation and appears hyperdense compared to the background. Here's a CT example. This is a focal fatty sparing area in that diffusely infiltrated fatty liver. Enlarged, diffusely hypodense liver, and this is a subcapsular area, and this is another spared area. Another example in the gallbladder fossa, the quadrate lobe sparing area here, and the other is segment 5, appears hyperdense area. On MRI, we should focus on the sequences that are sensitive to fat. And the most helpful is the opposed phase gradient echo T1 sequence. The background fat infiltration shows signal drop in that sequence, but the sparing areas show higher signal. They are difficult to find on T2 because most of the time they are iso-intense, but the lack of a mass signal is a comforting finding. If the fat infiltration is severe, then they may appear hypointense on T2, and fat-saturated T2 shows relative hyperintensity. Of course, no diffusion restriction and no pathological contrast enhancement. You will remember this example, the same case. You see very slightly hyperintensity here, no diffusion restriction, and the background is in higher signal intensity than normal, and on post phase image a prominent signal drop, but the focal fatty sparing area does not show signal loss. The signal intensity is increased on T2 and in phase gradient echo sequences, and a mass-like lesion appears here. On fat-saturated T2, the signal drops and the area is seen as a hyper-intense area. In a post-phase image, you see the signal drop due to diffuse infiltration, but this focal fatty sparing area is seen hyper-intense relative to the background parenchyma. And you can see the central dot sign here, which is a focal fatty sparing example. Focal hepatic steatosis is just the opposite. In these cases, fatty infiltration is focal and background is normal. And these are the common locations, quite similar to the spared areas. As the background is normal, and the focal area contains fat, focal area appears hyperechogenic in ultrasound, hypodense in CT, and fat content can be demonstrated by MRI. This is the typical location just around the falciform ligament, appears hyperechogenic than the background, and this is the central vein branch, quite typical example. Typical locations just around the falciform ligament, on either side of the falciform ligament, central dot is seen here in the gallbladder fossa in another example. In face, gradient echo, the focal lesion appears bright now in that case, and this signal drop makes this area fat. This is a specific sequence used for detection of fat. It's a fat-only sequence. Any area appearing bright means fat. So, fat infiltration, signal drop, and fat content in fat-only sequence of MDXN. Thank you for listening.